We'll take a few questions. Yes, please.
Mr. Vice President, a question for you and then a question for Dr. Birx or Dr. Fauci. Just to clarify, on the federal funding for testing sites in the states, are you saying that federal funding will remain for those sites, and will it remain at its current levels?
It's not merely federal funding, but in many cases we provided personnel from the U.S. Public Health Service and also flowed supplies, personal protective equipment that was required for some of the early forms of testing, but it's less required today with new formats for testing. It is an option, and as I've made clear to several governors, we'll continue to partner with our states. But I have to tell you that the way states step forward with the concept of drive-through and community-based testing is really inspiring. For our part, working with FEMA and our great team at the U.S. Public Health Service, we've stood up some nearly 50 different drive-through test sites around the country, but literally there are hundreds that have been deployed by states and by hospitals and local healthcare providers. But in this instance, we wanted to at least give them the option to take control of that, but we'll continue to resource them with personnel, supplies, and any other support that they need going forward. And
then just a question for the doctors. I'm curious, did you see this information out of the CDC in South Korea today that shows that they're seeing evidence of reinfection in some people who had been cured of coronavirus? And what does that mean for our understanding of this?
yeah, have you seen that?
I'm not aware of what you're speaking about now, but clearly there have been anecdotal mentioning of what appear to be reinfection. You have to really be very careful when you say reinfection, because and we were dealing with this with even Ebola back during the Ebola time, that someone might still, when someone does a test on them, do a PCR on a body fluid of some sort and be able to detect what are likely nucleotides that are not replication competent. So if you're telling me, which I don't think they're saying, that someone has coronavirus disease, they get sick, it's documented, they get better, and then a month or so later, they get sick with documented coronavirus disease. I don't think that's what they're saying, but I don't want to jump the gun on it until I see the data.
They use the word reactivate. Is that different?
Yeah. Well, yeah, what reactivating what means is that it depends what you mean by reactivating. If someone clearly is ill and they have virus isolated from them, that you may have a prolonged course. I'd like to see how long they reactivate. I mean, if they were sick and had documented virus, and then 3 months later they had documented virus, is that reactivation or is that infection with another virus? I'd like to see the data before I really comment on that. Yeah.
Dr. Fauci, I wanted to ask about medical criteria. You had a discussion with Dr. Birx and the other public health experts on Tuesday, I understand. Can you discuss what is the medical criteria that you guys are discussing in order to reopen the government? What is the medical criteria?
Well, it's less medical criteria than it is public health criteria. And that is, and I think it's really important because often people say reopen the government like it's a light switch that goes on and off for the entire country. We have a very large country with really different patterns of disease and outbreaks in different parts of the country. So it's not going to be a one-size-fits-all. It's going to be, what is the kinetics of an outbreak? Is it on the way down? Is it essentially out? Is it still smoldering and possibly going up? I think you're going to have to take it individually. And
are there some benchmarks that you're looking at, though? I mean, are there some numbers that you're looking at, some data that you would like to see? What would you like to see before that happens?
Yeah, well, I will allow Dr. Birx to come up with just my own opinion. I don't think they're going to be benchmarks that are going to be consistent from one to the other. For example, I would not want to pull back at all in New York until I was clear that that curve really was doing what we've seen in other countries, a very steep decline down, and we had the capability, if there was a resurgence, of having everything in place to be able to do the containment as opposed to struggling with mitigation with what we've been doing. That's different than a relatively smaller city, town, or whatever you, in the Midwest or mountain regions, which is generally very well controlled What I would want to see, do we have the capability of doing the isolation, contact tracing, and suppression of it? So it really varies differently. So I don't think there's one medical criteria. But Deb, if you want to speak to it.
Thank you. It's what I tried to cover in the brief presentation I gave. In talking to the 17 states that have indigenous populations and tribal nations, and discussing with them what they were doing generally and what they were doing specifically through the Indian Health Service, they discussed the ability to find new cases and doing full contact tracing. And so they have strike teams. They are very well organized. You don't hear about them every day, and that's why I wanted to call them out. They are really doing amazing work at their public health institutions with their governors and their mayors, and they are in full contact tracing. Yes, they're doing social distancing, but they're also doing full contact tracing and understanding all aspects of their epidemic. So we're looking at those pieces, as well as when I was talking about blunting, really when you're starting to go up that curve, having that unbelievable blunting where you only get evident attack rates, and I want to be very clear about that. When we see cases, these are symptomatics that have been diagnosed. There's clearly, we believe, people we don't see. And that's why the antibody test is going to be helpful to us to really define that. So those are the pieces that we're bringing together to really analyze that. I did want to say the president talks about the 150 plus countries that are experience what we're experiencing. I just wanted to do a call out. We have Americans around the world in every embassy that are working with those countries now. This scarf came from Africa. It's one of my public health colleagues there. I just want to recognize the public health colleagues around the world who are doing all of this work together to change the course in their epidemics in every single country around the globe.
Let me go to another question if I can, but in response to that, just so you know, what the president's tasked us to do is there's a number of working groups and that are looking at not only how do we reopen the country, but how do we stay open, and and I think most of America knows that no one wants to reopen America more than President Donald Trump, but the president's told us we need to do it responsibly, and we're going to follow the data. We're literally following the data on a county-by-county basis. This morning, we were literally presented with information of each county that had more than 100 new cases and had, went in the other direction, had, less than 100 than the day before. It's really remarkable. And so I think what you hear the health experts saying will inform the president's decision and timing. But make no mistake about it, that the best thing we can do to reopen America is put the coronavirus behind us, to reach the end of that curve with as little loss of life or hardship as possible, to have in place that we soon believe we will, the kind of therapeutics, I call them medicines that make you feel better, by this summer, to have more widespread testing that we're scaling up each and every day, and also to have the kind of guidance that the CDC is even now developing for businesses large and small, for families and for schools, for that day that we do reopen America. Question? Go ahead.
I'm going to ask one more follow-up to the doctors. It touches on this question of when to lean back on mitigation. There is a study out of Los Alamos this week that I hope you've seen. It's on the CDC website that looks at this question of R0, which is a technical term that you understand that has to do with the reproductive rate of the virus. The study shows that the R0 for coronavirus isn't between 2 and 3, as had been thought before, but it's actually closer to 6, which means that one person on average is infecting 6 others. So with this information, how does that impact the model? How can you begin to think about when to reopen society if it's more contagious than we thought before?
Well, I can tell you as the layperson on the stage,
Go for it.
we have known from the beginning that this is at least 3 times more contagious than the flu. And I believe that fact alone has informed our projections and the modeling, but now I'll let the experts respond.
I'll go quickly and then we'll tag team together. So when we've been talking about the asymptomatic group, and that's why I gave you that testing data where 11% of young people under 25 were positive, many of them very low-grade symptoms. What we will be triangulating for you is the testing data with hospital admissions, and then you'll be able to start seeing spectrum of disease. Because what you're not seeing in spectrum of disease is people who never even think that this is something significant, that what they have. We're seeing the significant cases. In testing, you can see that we're getting a lot of people in with symptoms who aren't positive. And so really finding out what is the R naught. Is it 6? Is it 5? And the only way to do that at this point right now is to get the antibody tests out there and go into these places that had significant disease. When we talk about attack rates of 7 per 1,000 like New York and 5 per 1,000 in New Jersey, and test the healthcare workers, the first responders, all of the nursing homes for antibody, and really get to your question. Because right now it's still theoretic. We understand they're modeling this, and we will get the data to actually look at that. You will see what others have been presenting, so you presented the 6. What others are presenting, importantly, is they're modeling what's happening with mitigation, and they're publishing that the R naught with mitigation is approaching like 1.3 and 1.5. So that, think of what that is. If it was 6, and then with mitigation, we have it into the 1s. That really shows the power of the American people. No one has varied R naughts like that without a vaccine. But this is what's happening with really the power of the American people, Tony.
Ditto to everything that Dr. Burke said, but I couldn't help but thinking when you talk about, you know what the worst enemy of an R naught is? Physical separation.
How about one more?
But do we have
One more.
testing-
Go right
do we have
ahead.
testing capacity in the country right now to reopen in the foreseeable future? I mean, because the president talked about 2 million tests. Are we going to have the testing capacity needed to make Americans feel comfortable going back into their workplaces? I mean, it seems to me that is a pretty critical question at this point. People are not going to want to go back to work if they think their coworkers might be carrying the virus. If we're not testing enough, how do we know it's safe to go back?
Well, I think the American people see the incredible progress that's been made after President Trump brought in the largest commercial labs in the world to scale testing, the likes of which we've seen. We are, as Dr. Burke said, well over 100,000 Americans being tested every single day. We have an antibody test that is coming online. Abbott Laboratories literally has thousands of machines across the country. We're working with hospitals and labs around the country to activate those machines for the 15-minute test.
Do we have enough testing right now?
Well, let me say we're moving every day toward meeting that moment. But let's be clear: reopening the country, as the president is very anxious to do at the earliest responsible moment, will be through a combination of facts. First would be that we are at the end of the coronavirus for most major communities. Another piece of that is that we have therapeutics for Americans to take medicines if they contract the disease. Another piece of that is guidance from the CDC to public institutions, to businesses large and small, about how to conduct themselves in a safe and a responsible way. And testing is also a piece of that. And as Admiral Joie has reflected, we are spending a great deal of time expanding testing today. Every single day there's more and more tests across the country. But we're also working to scale testing that as we move into this summer and move into the fall, we'll have the testing we need to do what these doctors call not diagnostic testing, which is to take a test of a person that has symptoms, but surveillance testing, so we can identify people that may have had it and may be immune, versus people people that we just need to know whether or not they were ever exposed or and were not exposed. How about one more quick question here, if I can? I think he had one right here, or I'll go to you in the back.
Thank you, Mr. Vice President. In the next few weeks, the Supreme Court is set to rule on DACA and on the deferred action for childhood arrival, and about 30,000 of those people who are under that program are frontline healthcare workers. Is the administration in any way ready to protect them if the ruling comes in your favor and takes the protection out and they can no longer work in the health field as they're needed right now?
Well, I think the president's been very clear on his desire to reach a solution on that issue with the Congress. But let me say, whether it be healthcare workers or people working in food supply, other people working in critical infrastructure, we're incredibly inspired by the way people across this country are stepping up to keep healthcare rolling and available. A high quality of care, even in areas deeply impacted by the coronavirus. And also, as we said the other day, hardworking people in our food supply, from the farmers to processors to distributors to truck drivers to grocers. We received a good word that over the last several days we've actually seen a significant drop with one major company in absenteeism. We issued new guidance from the CDC about how people who may have been within close proximity to someone who had the coronavirus could return to work before the 14 days if they didn't have a fever, if they tested themselves twice a day and returned with a mask. But the dedication of people to continue to work is truly inspiring. And I know as we go forward, we'll work through a broad range of national issues, but we're going to be incredibly proud for a long time by the way people all across this country responded to this moment. So thank you all very much. We'll see you tomorrow.